If you support families with infant feeding as a lactation consultant, SLP, therapist, doula, or other provider, you won't want to miss this. I'm Lisa Paladino, certified nurse midwife and IBCLC, and I'd love to invite you to my free 3-day video training. Why tongue tie is missed and how you can learn to spot it with confidence. In just a few short videos, you'll gain the clarity you've been craving around tongue tie, what to look for, why it's often missed, and how you can better support the families in your care. It's free, flexible, and made for busy professionals like you. Sign up now at tonguetieexperts.kit.com/free. That's tonguetieexperts.kit.com/free. The clickable link will be in the show notes. I'll see you there. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. Welcome back to the Tongue Tie Experts podcast. I'm your host, Lisa Paladino, and today we are going to talk about gatekeeping and silos and how to bridge the gap. Another title I was thinking about was Why I Don't Know What You Know and You Haven't Learned What I'm Teaching. So, as you may or may not know, I am a certified nurse midwife and a lactation consultant. I am so glad you are here. Today, we're not just talking about tongue tie. We're talking about something that deeply impacts every provider and every family we serve, and that's gatekeeping, silos, and the lack of true interdisciplinary collaboration in our field. So here's the truth. You don't know what I know, and I haven't learned what you know. We've all been educated in different systems with different philosophies, frameworks, and priorities. In my case, I have been educated in a few different systems. I was first educated as a nurse, then as a midwife, then as a lactation consultant. I've gone on and been educated as a functional medicine provider. And now, in the last 12 to 15 years, I've taken a deep dive into learning all about tongue tie and how that relates to breastfeeding and oral development. And my latest love is airway. So there's all different paradigms in which we learn. For example, dentists approach tongue tie from one angle, SLPs, body workers, and pediatricians, etc., from other paradigms, from other points of view. And even within lactation, there are divisions among the lactation world or within the lactation world. We're all here to help families, but we're speaking different professional languages, and we're often not taught to collaborate. That's just not an oversight. It's not just an oversight. It's a systems problem. And let's be honest, gatekeeping doesn't just happen across disciplines. It happens within them, especially in lactation. There are what I call cliques. There's exclusion of those who haven't earned the highest level, the IBCLC credential. And many courses, especially on complex topics like tongue tie, don't invite other lactation professionals like CLCs or doulas or peer counselors or breastfeeding educators. But here's the reality. Most families never get to see an IBCLC before they quit breastfeeding. Or they see an IBCLC they see a CLC or a doula or a WIC peer counselor or the nurse at the bedside for the help they need. And oftentimes they get very good help, but there's a small percentage of people who need a little bit more. But so say, for example, say the bedside nurse had taken Professional's Guide to Tongue Tie, and she may not, be completely able to diagnose or refer, but she can educate based on what she learned in my course. So if she's not welcome, because she's a nurse and not an IBCLC, if she's not welcome in a tongue tie course or a tongue tie community, then that family is going to lose out. Multiply that by how many families she sees. The same with doulas and midwives, and I can go.
Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today.
Down the line. So when we exclude any providers from education or conversations, we're not just gatekeeping, we are hurting families. Those professionals are often the first and sometimes the only line of support. So why does this matter in tongue tie care? Nowhere is this more apparent than in how we learn to take care of tongue-tied babies and their families. When one provider works in a vacuum without understanding the broader picture or without knowing when to collaborate, outcomes suffer. What can happen? Some of the things I see are babies having procedures too soon, or oral function that isn't addressed, or parents getting mixed messages from all the different providers they see, and then they don't trust anyone. We and the families that we serve cannot afford this kind of disconnection. Not when families are in crisis, struggling with feeding, sleep, pain, and especially uncertainty. So what do we do? What do we need here? What we need is inclusive, interdisciplinary education. What that means is training that welcomes all lactation providers, not just IBCLCs, and collaboration across all the fields: lactation, bodywork, dentistry, myotherapy, speech, medicine, etc. Now, when I make these lists of professionals, I always inadvertently leave someone out. And there is, here's a talk about inclusivity. If I left you out, no offense, it's just really hard to say all the professions all the time. My world, my platform, my courses, my podcast, my groups, free and paid, are open to everyone. If you're a professional, right? If you're a parent without a medical degree, this is not for you. I am teaching the caregivers, right? And connecting the caregivers. And there is no gatekeeping here, right? So I have been criticized, and I know I get criticism from some IBCLCs who think that there is no place for a CLC, for example, or a childbirth educator to be included in a high level course about tongue tie assessment and treatment. And I will stand my ground. I disagree. We have to all understand our rules. And that's why in the course, I go deeply into scope of practice and how to refer and how to work together and how to build a team. Because, as I said before, many of us will never get to the IBCLC. And who better to bring the patient to the IBCLC than a, say, doula who recognizes the need for an IBCLC and refers them. That's where this is coming from. We need to have, let's put it that way, a willingness to learn from each other, not just protect our own turf. There's enough mamas and babies to go around. We need to shift from what's your credential to what's your skill set and how can we work together to support this baby. That's why I created Tongue Tie Experts, to break down the walls, to create a space where you don't have to already know everything or have a certain title to be welcomed in, because everyone who supports breastfeeding deserves access to evidence-based holistic education. So how am I working towards bridging the gap? My entire platform, Tongue Tie Experts, is designed with this mission at its core. I've been advised by multiple business coaches and marketing experts to narrow my focus. They tell me it's impossible to speak to everyone. I don't know if you've ever heard this, but there's a popular marketing tenet that says, if you're talking to everyone, you're talking to no one. Well, if you know me in real life, you know that if you tell me something is impossible, I will double down and make it happen, especially if it's something I believe in. And this is truly a core belief for me. We all need to sit at the same theoretical table in order to advance care. In many types of patient care, but especially when we are considering care of a dyad, as we are in breastfeeding and tongue tie treatment, we need to learn to speak to each other and look at all aspects of the experience of the mother, the baby, and the feeding. As I said, this is why I include everyone in my professional course. It's not just about teaching assessment skills or protocols, though I do that too. It's about giving you the full context, how function, anatomy, and symptoms interrelate, how to collaborate across disciplines, how to build a team across disciplines and get people in the same room talking to each other, and how to support families in a way that gives them clarity, breaks through that confusion, and gives you confidence. Whether you're an IBCLC, a CLC, a CBC, a CBE, a CLE, an OT, a PT, an SLP, a doula, a midwife, an MD, a DO, a chiropractor, CST provider, dentist, nurse, etc. I hope I got everybody. This isn't for the most credentialed. It's for the most committed. So here's my invitation to you. If you've ever felt left out, if you've ever felt like your voice wasn't valued because of your title, if you want to stop working in a silo and start feeling like part of a collaborative, informed, heart-centered community, know that you belong here and you are welcome here. The course is always open, but more importantly than that, you are open to learn from all of my free options and offerings, to send me messages, to visit me on Facebook and Instagram, and to be a part of the world of Tongue Tie Experts, where we are changing the world one baby, one mama at a time. Thank you so much for listening today. I hope you find this helpful. I hope that you can pass this to someone who needs to hear it and join my mission to help to elevate the profession that we're in and make care easier on us and the families that we treat. Have a great day.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Have you ever wished you could help that mom who is questioning if she has enough milk? Ever wanted to either reassure her or know when to refer? As a lactation consultant, I created the program Understanding Milk Supply for medical and birth professionals to help you to feel more confident in those exact situations. This affordable, recorded video mini course is open to anyone who works with pregnant or breastfeeding families. It's a particularly valuable opportunity if you're an SLP or an OT who wants to gain an understanding of how breast milk is made, or a dentist in the field who is often the first-line provider for tongue-tie treatment. The function of the infant at the breast depends on milk supply. Even if care of the mom isn't in your scope, there are basic principles that you can learn that may rescue a family's feeding goals. In Understanding Milk Supply, I teach you what red flags to look for, when to refer, who to refer to, and how to advise the family in the meantime. And there's one LSERP included for lactation professionals. Go to www.tonguetieexperts.net/milk-supply. The link is clickable in the show notes. And as always, you can use coupon code PODCAST15 to save 15% off this and all Tongue Tie Experts courses. Thanks so much.